Acute ankle sprains are common and generally recover very well. Low ankle sprains are the most common variety and can occur at any age. Generally, the ankle rolls inwards, which is called inversion, to cause these injuries, and most of the time you can take a few steps, even though there's pain when putting weight on the ankle. A grade 1 injury is the most common and generally just involves this ligament at the front, called the ATFL, short for anterior talofibular ligament. People generally recover very well and function even if this ligament doesn't fully heal. A grade 2 injury occurs as more force is put into that inverted position and then partially or fully tears the next ligament in line, called the CFL or calcaneofibular ligament. A grade 3 injury is the highest grade, with full tears of both ligaments and sometimes even with injury to a ligament more toward the back of the ankle. Ankle stability can be tested immediately after injury to determine severity, but once the swelling sets in, we generally have to wait 4 to 5 days to get a good idea. A fracture is very unlikely if you can take more than 3 steps or are not particularly tender around the bony regions of the ankle. And this is how we decide whether or not X-rays will be required to further assess the injury. The ankle can be very swollen since the ligaments can bleed a lot from their torn ends, and sometimes this forms a very large, impressive hematoma that is in fact out of proportion to the extent of the injury. In most cases, the pain and swelling settles down markedly by the 2-week mark. If that's not the case, then seeing a physician and discussing the merits of further imaging is reasonable, because there are a lot of occult injuries that can occur around the foot and ankle. As with any acute injury, the principles are to control the initial inflammatory response with rest, optimal loading, ice, compression and elevation. It's important to realise that the evidence overall doesn't show a correlation between the grade of injury and the long-term outcome. Higher grade injuries, in fact, may do better with early immobilisation, but only for a very short period of time, generally less than 10 days, because this can then cause other problems with ankle stiffness. We know there's an increased risk of re-injuring the same ankle because the torn ligaments serve proprioceptive functions, because their nerve supply can tell you where your foot is in space. And this is the main value in ensuring that patients invest in a proper course of rehabilitation to prevent future injury. Chronic ankle instability. Unfortunately, some patients progress to recurrent ankle sprains, which are very frustrating and may predispose to ankle joint damage and early osteoarthritis. The reason a doctor needs to really listen to what a patient's saying here is that instability is something that only a patient can tell us, not something that can be concluded simply by examining the ankle. A patient who doesn't trust their ankle, is worried about walking in the dark, and has usually had a number of sprains, has chronic ankle instability. They might also have pain in between episodes of sprains, and they've usually had to modify their life and their activities around preventing further injury. The most common cause of recurrent instability is inadequate rehabilitation, and most clinicians don't refer patients without serious problems for surgery until they've tried good quality rehabilitation for at least 6 weeks, in combination with bracing and potentially taping to assist in proprioception. The evidence shows us that taping and bracing reduce the risk of recurrent sprain immediately, to the same level that rehabilitation alone would by the 10-week mark. But if despite this there is ongoing ankle pain, swelling, and over 3 episodes of significant ankle sprains in a 12-month period, then a patient with chronic ankle instability really should see a foot and ankle surgeon for an opinion.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.